so I'm going to be performing amputation care. So the first thing I'm going to do is I'm going to follow my evidence-based checklist. I'm going to identify my patient according to agency policy. I'm going to practice standard precautions, so hand hygiene, safety, privacy, and good body mechanics. So amputation types, the first one is a surgical amputation, which is an elective one, and this is often planned or elected or expected, caused by diabetes, peripheral vascular disease, an untreated infection, or neoplasms that hinder tissue perfusion and lead to ischemia or cell death. And then there's traumatic amputation, which is emergent and unexpected. So the first thing you're going to do is immediately control your bleeding and replace the blood lost from the injury. You're going to apply a tourniquet to help stop both arterial and venous bleeding. You're not going to leave this on for any longer than 6 hours, or necrosis will occur. You're going to perform a rapid but thorough injury assessment. You're going to want to use a large bore IV for replacement of fluids, pain control, blood transfusion, or possibly sedation if needed. You're going to obtain a CBC and coagulation panel to establish the need for immediate blood transfusion. You are going to obtain a serum lactate level to help determine the level of hypoxemia and gauge the success of resuscitative efforts. Then you're going to obtain the type and cross-match the blood if a blood transfusion is needed. And then you're going to prepare the patient for surgery if they need it. So then you're going to teach about the post-operative care. So you're going to teach about phantom limb pain. It's numbness, tingling, sharp burning pain. You're going to observe for neuroma formation. This will interfere with proper fit of a prosthetic. Can't talk, sorry. You're going to look for pain control, antibiotics, and then you're going to talk about compression to decrease edema and make sure the correct fitting of a prosthetic whenever they would get one. So you would first do a figure 8 technique like so. And you would start this 1 to 3 days post-op. You'd wrap from distal to proximal. You're going to start with minimal tension and increase it gradually. You're going to rewrap 2 or 3 times a day. Keep wrapped unless bathing, and then if pain occurs, the wrapping is probably too tight. So then you're going to teach about nutrition and hydration. So protein and carbohydrates allow for adequate healing of the bone, muscle, and skin. And you would want to increase your daily fiber to prevent narcotic-induced constipation. Wound care, so you're going to use aseptic technique, and to decrease the risk of infection. Signs and symptoms of infection would be warmness, temperature increased or purulent drainage, redness, and if you do see signs or symptoms of infection, you would want to notify your physician. You would want to do range of motion exercises to prevent contracture and strengthen muscles. You would want to give them community resources, so social services, case manager, support groups, anything to help with the healing process, and they may need help at home with the healing process. And then you're going to collaborate with a physical therapist and a prosteo-orthologist, and promote adaptation to new lifestyle and help ensure that the prosthesis fits properly and securely.